Welcome to today's session on assessments in the primary care sidebar. My name is Matthias, I'm working for RSCGP Oxygen and I will guide you through today's session. We are going to run an assessment here on a client called John Andrews. I'm using Medical Director today, but this is exactly the same if you would be using best practice. No difference between the two systems in terms of sidebar. We can access and extract the same amount of clinical information and pre-populate the assessments no matter if you're using MD or best practice. So I'll start by expanding my assessment panel. You have a number of assessments there to choose from diabetes risk, cardiovascular risk. There's 3 different mental health assessments and 2 on foot care. We're just going to pick a cardiovascular risk assessment today. Selecting it in here and then clicking on the green arrow will start the selected assessment. If you want to know more information about it, the blue eye in the circle here will open up the actual background to how the assessment was created and more information on what it is, how is it calculated, the score, and most of these. I won't go into there now. So we're starting the assessment, clicking on the green arrow. As you can see, a large number of these fields are already pre-populated, extracted from your clinical system. We have the blood pressure in there, the lipids, his cardiovascular history, he's a smoker. Some of these are not in there now. I'm filling them in now. Some of them might be missing because there's no diagnosis there, or others because it's an item that's normally not recorded as a diagnosis as such, but in the progress notes where we cannot extract information from. But yeah, so you can see still the majority of the items have been populated. Waist, weight and height are in there now. And clicking on next will give us a score. So for John here, he's in the red area with a 15% or greater risk of cardiovascular disease within the next 5 years. You can view or print this report, clicking on the view print link at the bottom here. This will open up as a PDF file which can be exported, saved out of sidebar by using the little floppy disk icon up top here. You can choose between Excel or PDF, which is for documents would be the preferred format. I'm clicking on here and I'll just call that John Andrews. And I will explain to you in a minute why I'm saving this. The results, the assessments, all of this, once you click on finish, is actually stored within sidebar. To access past assessments, clicking on HX history will bring up any past assessment that have been done in your clinic. So it could have been done by yourself or by other doctors or clinicians as well. You can see the score, the name of the doctor and the date, and of course which assessment it was. To look at it again, you can highlight and then click on select. You get the same report again. And yeah, as I said, other assessments would be displayed in here as well. Now, if you want to keep that information within your clinical record, in this case Medical Director, we cannot write back directly into your medical system at this stage. There is ongoing negotiations and we hope to resolve this, but currently you would have to import it back in. So in Medical Director it's under Documents, in Best Practice it's under Correspondence in, pretty much the same process. We have saved it from the assessment screen as a PDF file and now we're importing that file back in, and I called it John Andrews, so he should be somewhere here. There we go, open. I'll just leave the names as they are. You could change that. Clicking on OK. And now you have his CVD risk assessment in your Medical Director patient record. This could be done by someone else in the clinic as well, just depending how you organize workflow. But anyone who can access Medical Director and has sidebar running can click on HX and access the assessments that have been done through here as well. The only other thing of note in here is the menu item there. You can click on that and you can see the assessment types, and you could turn some off in here by right clicking. So if you don't want to use the diabetes risk assessment, right click will remove it from the list. I won't do that now, I'll put it back in, and after that you have to apply changes. The question mark that appears on all of our panels, clicking on here will get you straight to our user documentation. So there is a quick reference guide, which is normally between 2 and 4 pages max, and then there's the full manual, which is considerably larger. So you could download these and print or just keep them in an electronic format. Thank you for taking the time to watch this little video clip. We hope this will help you with the use of the primary care sidebar. If you have any other questions or need help, please contact our free call help desk, the RSCGP Oxygen Help Desk line on 1-800-257-053. Thank you.